Sisters, hey sis, hey sisters. Look at my own self coming up on the comments. Too funny. Great evening, sisters. Welcome to Thursday night with Dr. Sam for right now because we're going to switch over to Dr. Tam real soon. So she needs no introduction. She is one of our vice chancellors of Sister Circle University, our beautiful Dr. Tam. She's going to be coming to us on this evening to talk about women's health. And just like CP said this morning, we want to be whole. You know, we want to be spiritually fed, but we also need to make sure that we are well because our body is a temple of the living Holy Spirit. And if the Holy Spirit dwells within us, he doesn't want to have to dwell within a house that is broken, cracked down, run down, whatever down, busted, disgusted, whatever you want to call it. So we want to make sure that we are whole, not just spiritually, but we want to be whole even in this beautiful temple that has been granted to us. So physically, in every aspect. So I am going to step away now and I'm going to introduce my sister, our co-vice chancellor, Dr. Tamra Cable, or also known as Dr. Tam. So Dr. Tam, welcome this evening.
Thank
And I'm going
you.
to hand it over to you. Ladies, don't forget, place your chats not your chats, excuse me, your questions in the chat. And let's drop some fire for our sis. Let's drop some yellow hearts for our sister. Let's drop some clap emojis for our sister on tonight as she drops this knowledge on us. I told her I have questions on top of questions.
Don't do me like that.
Because, even as you become more seasoned, there's different things that happen in your body, and you need to be aware of that. So I'm excited about tonight's presentation. I'm so excited. So, Dr. Tam, take it away.
Thank you so much. Good evening, sisters. I am so excited to be with you today and share just a little bit about women's health. I do have to be very transparent with you. Preparing for tonight has been a joy and my nerves have been working up, but I think I'm gonna be okay today. So I don't know if you can see the presentation or not, but I do want to, there we are. So just a little bit about tonight. We're going to talk about some of the things that affect us as women. So women's health, as you know, there's no way in this amount of time that we can go over everything that affects us as women, but we're going to go over just a few things. And of course, there will be additional opportunities for you to learn more about yourself and your health later on. So we can advance to the next slide. So a little bit about me. I am Tamra Capel, fondly known as Dr. Tam. I'm a proud graduate of UNCG. They have all my money. 99, 06, and 17. I am married to my husband, Maurice Capel. We've been married for 17 years this year. I'm the mom of a spunky 7-year-old Arrington who loves the Sister Circle, as you can see down there in the bottom corner. And I have the honor of serving Sister Circle University with Dr. Sam and Dr. Bynum. And I'm so happy for this opportunity. I have been a registered nurse for 23 years, and much of my career has been in leadership. I've been in nursing leadership for the last 15 years, but started off as a nephrology or a kidney nurse working in dialysis. And so nursing is my passion. Helping people, helping to connect our underserved populations to resources that they know nothing about is really important to me, and population health as a whole. And so tonight, hopefully you will hear my heart and learn a few nuggets. So as you may or may not know, I am a doctorally prepared registered nurse, which means that I do have a doctorate in nursing practice with a concentration in executive leadership. What that means tonight is I am not a medical doctor. So I am not your primary care physician. I do not write prescriptions. I do not diagnose. Those things are out of scope for my role. But what the doctorate in nursing practice does is it does give me an opportunity to emerge as a healthcare leader and use the evidence and data to help us transform healthcare. And so that is what the doctorate is. So this is my little disclaimer. Any of the material that I share with you this evening is for information only. In no way is it intended to take the place of a consultation with your provider. I want you to still call your doctor if you have questions. These are just little nuggets that I've found useful for you using some reputable websites. That you also can find, but I've just dug them out for you. So tonight what we're going to talk about are just some of the common or important facts or myths that are related to our health and well-being as women. Now, this is going to be an interactive session. I need to see you in the chat. I need to see you answering these questions. There are no wrong answers. And actually, there will be a quiz at the end of the presentation today. And whoever gets the highest score will win a free nudge in the morning with Lady Leah. So all you have to do to claim your prize is log on at 6:30. See, you win. All right, so let's get started. So the first question is fact or myth? Men are affected more than women by heart disease. What do you think? Let's see it in the chat. Is that a fact or is that a myth? Okay, I see some answers coming in. Well, that is certainly a myth. I know that Women's Heart Month just passed, but we really cannot talk about women's health without talking about heart disease and heart health. I see it. I see some right answers. We just cannot talk about women's health without mentioning heart health or heart disease. Although heart disease is really thought of as a man's disease, almost as many or more women than men die of heart disease each year in the United States. And heart disease is really considered the leading killer of women. And maybe you knew and maybe you didn't, but heart disease does affect men and women very differently. So on this next slide, what you're going to see are just some numbers really around women, African-American women, and heart disease. So just a couple of the points on here that were interesting. Of African-American women 20 years old and older, 49% of those women have heart disease. And the scary part about it is that only 1 in 5 African-American women believe that they are at risk. So if 49% of women have heart disease and only 1 in 5 of us believe that we are at risk, and only 52% of African American women are aware of the signs and symptoms of a heart attack. And we're going to talk about that a few slides back. So just put a pin in that. But what this slide is saying is that more American women die from heart disease than any other cause. But this disease has a much bigger toll on Black women. So you and me, your daughters, your aunts, your mothers. Half of the Black women in the United States do have some form of heart disease, and there are a number of reasons for that. There are lots of risk factors. Some of them we can do something about, and some of them we cannot, but we'll talk about that in a second. And stress further deepens this disparity because chronic stress increases your blood pressure, which then leads to other health issues. And so some of the risk factors for heart disease that you really can do nothing about are family history, your age, gender, race. Those are things that we really don't control. But there are some modifiable risk factors like our diet, making healthier food choices, increasing our physical activity, stop smoking, managing our weight, monitoring our cholesterol and our blood pressure. And I don't know if you know or not, but blood pressure, people with high blood pressure, sometimes they have symptoms and sometimes they do not. And so it is really important for us to make sure that we are being screened and monitoring our blood pressures. Also, a couple other things that are not on the slide: limiting alcohol use, and of course, again, managing stress. And so some of the things that you can do are get your blood pressure checked, know your family history, and of course, manage your stress. Another risk factor is uncontrolled diabetes. So uncontrolled diabetes further increases our risk for heart disease. And diabetes is a modifiable risk because with diet and exercise, we can manage and control the diabetes. On this next slide, I'm going to talk a little bit about the signs and symptoms of a heart attack for women. Okay, so who knows? And you can put it in the, yes, Simone, good. She already answered the question before I said it. I was going to say, who knows another name for heart disease, but sometimes it's called the silent killer. And the reason for that is because heart disease really might not be diagnosed until you are symptomatic or you have an emergency. Okay. And so some women have no symptoms when they are having a heart attack or when they have heart disease. There are sometimes no symptoms, but we need to know what the signs are. You don't want to wait until you're having symptoms to get help. You want to be getting these checkups regularly. Some heart attacks are sudden and intense, and most from what I've seen in the literature, start slowly with mild pain or discomfort that people sometimes put off and then end up with a large event. But the active symptoms for a heart attack will happen when you're at rest. They might happen when you're doing regular activities. It'll be for no reason at all. You're just sitting there and boom, you have some of these symptoms. So let's talk about what they are. The main symptom that most people know about is the chest discomfort. So when I used to work on the inpatient space in the hospital, the patients would describe it as, I feel like I have an elephant sitting on my chest, or I'm feeling like some squeezing, or my chest just feels very full and uncomfortable. It wasn't always a sharp pain. Sometimes it was just that heavy pressure that they would explain. Discomfort in other areas of the body. So pain in your arms, one or both arms, sometimes pain in your jaw or your back. Shortness of breath with or without the chest discomfort. Cold sweat, nausea, lightheadedness. So the cold sweat, sometimes the nausea and the lightheadedness, those are some of the ones that are usually specific to women. As you can see on this slide, paleness, that clammy feeling of your skin that goes along with the cold sweat. Unusual fatigue, dizziness or lightheadedness, the shoulder. Some of the patients would explain it as being pain in their shoulders or like their scapular area. Heart flutters. So we're not going to talk about this tonight, but atrial fibrillation. So where your is kind of what people describe heart flutters, but it's where your heart is just beating really, really fast. And then nausea, vomiting, or inability to sleep. And I see in the chat where somebody put, I felt nothing. So you are correct. This is real life. These symptoms can come on and you not even know that you've had an event until you go get a test or go get checked out by your provider, or you have a true emergency. Okay. So the main things that I want you to remember from this first section is that heart disease affects a lot, over 50% of us. Okay. Women in general, it is a leading killer. And there are some things that we can do to prevent heart disease, to modify those risks. And part of what we have to do is be informed. And one of the things that I like to caution people is that, you don't want to wait until you've had this pain or discomfort for 2 weeks, 3 weeks before you say, I may go to the doctor. Sometimes it warrants just calling the provider and saying, you know what, I've been having this chest discomfort, or I've been getting really winded for no reason, or I've been feeling like my heart is fluttering. I would rather you be safe and go get checked out than to have a major event that can lead to death and you not even know that you had heart disease. Okay. So that's the short version on heart disease today. And if you have questions, you can put them in the chat. If there are things that I cannot answer right off the cuff, then we will make sure that you get the answer to those, because I want to make sure that you are given accurate information and not just my thought information. Okay, so the next question is, everybody should get this right. Women who are caregivers are at greater risk for poor physical and mental health, including depression and anxiety. Fact or myth? Let's see it. Let's see it. Fact or myth? Well, I see it in the chat. Fact. This is certainly a fact. Women, I think, just by our true nature, we are caregivers at heart. And the CDC reports that 1 out of every 3 caregivers in the United States is a woman. And I believe their definition of caregiver is different than mine because I'm a caregiver. I care for my husband, I care for my daughter, I care for my home. But I believe they're thinking of like a family member caregiver or caring for another person in that instance. So this is really no surprise to any of us, I'm sure. And women who are caregivers are indeed at greater risk for poor mental and physical health. And during the pandemic, the literature shows that there was a higher incidence of depression and anxiety along with this poor physical health. Okay. So, one of the references that I reviewed said that the depression is really happening at a higher rate than most other illnesses, including diabetes and cancer. Okay. And this is especially alarming for us minority women because women are at least twice as likely to experience a major depression as men and compared to their Caucasian counterparts. Some of this is because our access to mental health care and cultural sensitivity is really has been difficult for minorities and women to seek out the assistance that they need. So it takes a little bit more for us to say, okay, I'm going to call a counselor. I'm going to go talk to somebody about what I'm feeling. Okay. So caregivers, it is really important for you to make time for self-care. And that includes maintaining a healthy lifestyle, active lifestyle, and reaching out for the support that you need. So for caregivers, one of the things that I think is underused for people who are caring for family members or are in the role of a caregiver is respite care. Okay. And so respite care is a resource that is available. And when used, it really just allows the caregiver to take a pause. It provides you with some short-term relief from caregiving. And I did find some one website that was backed by the National Institutes of Health. You can go to the next slide. It's this archrespite.org. And it really talked about respite care. You can go to it on the website. There may be some costs associated. You can check with your insurance plan to see if respite care is covered or if it's not. You can find some other services that are available in your area because you can find those services on the National Respite website. And so what this is, it is really just a National Respite Locator. Okay. So if you go to the next slide, I'll show you how it works. The National Respite Locator, these are the slides. You put in what state you live in. You put in the age of the patient. You put in your zip code and you hit enter. And it pulls up, and you can't see here because the slide was so small, but it does pull up any of the available respite care services in your area. And so, respite care is very important. I know that Medicare will cover some costs if you are caring for a patient who is enrolled in hospice, and Medicaid does also cover some costs. It doesn't hurt to ask. You don't know what's covered by your plan until you ask the question. And what we found in my daily work, I work with Medicaid patients and Medicare patients, high-risk Medicaid patients. And so what we found is that a lot of the plans have expanded their offerings to cover some things because of the pandemic. Okay, so it doesn't hurt to ask. And a couple things, not really on this slide, but I will tell you, respite care is self-care. And as women, we need to get in the habit of remembering that self-care is really not selfish. If I am not caring for myself, it is very difficult for me to be my best self for everybody else, whether I'm caring for grandma, uncle, a child, my family. So we have to get it out of our mind that self-care is selfish, because self-care really, I don't know what's going on over here. I'm sorry. The puppy has just gotten out. My apologies. But self-care is really necessary. It's not selfish, it's necessary. Okay. And so you're probably thinking, I have zero time for self-care. I just told you I'm caring for a family member, I'm working full time. And these kids are, out of school, eat us out of house or home, but we have to make time for self-care. And so I challenge you and me to spend some time thinking and putting into action a plan, because we have to realize how valuable our health is. Okay. And self-care helps us to manage our stress and manage the things that we are responsible for. So one suggestion that I have is that you plan it. You put it on your calendar, like the meeting at work, like the child's soccer practice. You put it on your calendar. Self-care does not have to cost you one penny. For some of us, taking a nice stroll outside alone with our thoughts is self-care. For me, I enjoy a good mani and pedi by myself, a good nap. For some people, clearing clutter in their home is self-care. Getting your hair done, having the opportunity to sit down and drink some water, do something that you're passionate about. It doesn't have to be all day. It can be a 30-minute stint or 15 minutes. Sometimes, when I'm at home and I've gotten tired of everything and everybody, I just lock myself in the bathroom for a good 15 minutes and read a couple scriptures, listen to some music and come back out refreshed. So please take care of yourself and be mindful that we have to care for ourselves first. It's not selfish, and I can't care for anybody else if I'm broken all to pieces. Okay. Next, the next thing I want to talk about is fact or myth. If you are healthy, you do not need to go to the doctor. Is that a fact or a myth? Somebody said they want to get a mani, pedi, and a nap. I'm with you. Fact or a myth? If you're healthy, you don't need to go to the doctor. You run every day, you eating a healthy diet, you look good, you summer ready, summertime fine. That is a myth, okay? Everyone should visit their healthcare provider routinely. It's just an opportunity for you to be screened for any medical issues. We just talked about some that don't have any symptoms. Everybody needs a good set of lab work every now and then, at least once a year. It's a nice time to assess the risk for future medical problems, and ensure that you're up to date on your vaccinations. And it's really important for you to visit your provider because it's good to get to know and establish a relationship with the provider. What if you get sick? What if you were to get sick and you haven't been to see your PCP? Who's going to know your health history? Who's going to know that 6 months ago she was in my office and we had labs and this is what we saw? So we have to make sure that we are seeing our provider, so that we have someone to speak for us if we have an illness. Okay. And some health plans do offer incentives for preventative care and wellness activities that you participate in. Okay. So I know that at work, there are some of the health plans that for our patients who receive their COVID vaccine, they got $50. If a patient has done their wellness screen, they were given other incentives. So it does benefit you very well to go see your provider. Okay. On the next slide, I do have an excerpt. This is actually, I pulled the checklist from my insurance company. For what health checklist. This is just an excerpt of a health checklist for a 45-year-old woman. Yes, I'm 45. I know I look 17, but yes, I am 45. And so things have changed. And this is just an example of my health screening. I'm sorry. I'm telling my dear husband to come get the dear doggy. Okay. Oh, and I see someone says they have rewards at United Healthcare. Okay. And so depending on your own personal health screening, health history and family history for certain illnesses, your provider might suggest that you have more frequent or early screening in some areas. Okay. So for some patients, if you have a family history, a heavy family history of breast cancer, they may begin your mammogram screenings earlier, or ask or have you have them more frequently. Okay, but there are specific times when you should see your provider, and there are tons of screening guidelines. There are tons of screening guidelines on the internet, at some reputable places that talk about guidelines for women ages 18 to 39. So I'm just going to go through a couple of these areas so that we are able to just see what I'm talking about. So one of the areas is blood pressure screening that we talked about a little bit earlier. So the recommendation is that you have your blood pressure checked at least once every 2 years if it is within what we consider a normal limit. Okay. And so some of the literature says if your top number is between 120 to 139, or the bottom number is within good range, between I think it's 70 to 79ish, then you can get your blood pressure checked every 2 years. If the top number is 130 or greater, or if the bottom number is 80 or greater, then your provider may want you to have the blood pressure checked a little more often. Now, these time frames are also determined by what other illnesses you have going on. If you have diagnosed heart disease, or if you have kidney problems or diabetes, or certain other conditions, then your provider may determine that you need to have these checks more frequently. We also need to have cholesterol screenings. Okay. Most of the literature that I read recommends the starting age for cholesterol screenings for women 45, or that's for women with no known history or risk factors for coronary artery disease, and age 20 for women with any history or risk factors for coronary artery disease. Okay. Diabetes screening, those are recommended if you have a high BMI, or body mass index over 25. That means that you are obese or overweight. Then they will begin those diabetes screening usually around age 35, depending on your weight and other risk factors. Of course, you want to have your teeth checked, dental exams. I don't know if you know this or not, but poor dental hygiene can have other effects on your body. It can have negative effects on your heart. It can put you at risk for infections if you have abscesses that are not treated, or other like cavities and things like that. So dental hygiene is very, very important to your overall health. So that's not something that you want to kind of let slide to the side, because it can really affect your dental health. Your general health. Okay. Other things, your eye exams. Okay. We know that our eyes need our help, and we want to make sure that we are having our eyes screened. Again, if you are at risk for diabetes, or you are diabetic, then you would have to have those screenings more often. Also, breast cancer screening. Please get your mammograms. And also, women are recommended to do a monthly self breast exam. However, you also need to get your mammogram. Okay. And sometimes the providers do a clinical breast exam just as part of your physical. I'm sorry, I got tongue twisted. As part of your physical, but you also want to get your mammogram every 1 to 2 years. And that just depends on how your provider. Somebody said that they needed to get their roles in check. Don't we all? But that the frequency will depend on the rest of your health history. Another important screening is cervical cancer screening, and really that should start at age 21. Women at ages 30 to 65 should be screened with either a PAP every 3 years, or the HPV test every 5 years. It's really uncommon for your gynecologist to do PAPs anymore every year. I think it's gone every 3, depending on your other risk factors. Okay. And so your pap smear is very important. Getting that done on a regular schedule, not forgetting, because cervical cancer is a real thing. And again, you might not have any more symptoms for that, but you need to get that checked. Okay, we talked about cholesterol screening, colorectal screening. So, screenings for colon cancer. Sometimes your provider will have you do that stool sample, checking for occult blood, fecal occult blood, or hidden blood in your stool. Sometimes they will have you do a colonoscopy, and please don't skip out on your colonoscopy because it's not pleasant. Nobody likes a colonoscopy, but it is very important, especially if you have a family history of colon or colorectal cancers, or if you have any kind of ulcerative colitis or any kind of growths in the colon called polyps. You want to make sure that you're getting your colonoscopy done. We talked about your teeth. We talked about the diabetes, eye exams, and make sure you get your immunizations. I know that people feel differently about immunizations, flu shot, COVID. I'm not here to tell you to get it or not. Just make sure you are up to date with whatever you're comfortable getting. It is personal choice, but it is important to make sure that you're up to date. So if you do take your flu shot, make sure you get it every year. Ask your provider if you're of the age that needs the pneumonia vaccine. Are you up to date on your tetanus shot? Because that should be boosted at least every 10 years. Some people choose to get that shingles or the herpes zoster vaccine at around age 50. I think is when it's offered, at or after 50. And your provider may recommend other vaccinations if you are at high risk for other infections or conditions. Okay. Next, osteoporosis screening. So all women over age 50 with any fractures should have a bone density scan. It's also sometimes called a DEXA scan. And if you are under age 65 and you have other risk factors for osteoporosis, then you should be screened as well. And then, of course, just your regular physical. And during your exam, be comfortable asking the doctor questions. If you are having signs and symptoms of depression, ask for some resources. Not necessarily are you asking for medicine, but you're asking for resources. What therapists are covered with my plan, or who can you refer me to? Those kind of things. If you need help with diet and exercise, ask them to be referred to a dietitian or a nutritionist. Because many of the doctor's office and many of the health plans are now offering lots of incentives around diet and exercise. I know at my job, we get 50% off of Weight Watchers if we show that we have lost weight over the period of the year. You know, you have to ask the questions and advocate for yourself, because the way the provider schedules are created, sometimes they're on a 20-minute time frame. They're trying to get in and get out. But if you have your questions written down or in your phone, you ask those questions. And for some of my older patients, that would go to the doctor's office and not really have an advocate, but they didn't really quite understand what the doctor was saying, we would have them call a trusted family member. If the daughter lived in Seattle and they lived in Greensboro, you call her on speakerphone while the doctor is in the room, so that the family member can also hear what the provider is saying. And if there are things you don't want her to hear, then you tell the doctor that before you get her on the phone. But you need to make sure that you advocate for yourself and ask the questions that you have while you are at your provider's office. Okay. And 20 minutes is, it probably includes the CMA. Maybe that's a lofty goal. And then the other thing is just skin exam. Make sure that you are having your provider check your skin for any signs of skin cancer if you are high risk for that. So if you have a family history, if you spend a lot of time in the sun, if you have some melanomas or places on your skin that you've been told were cancerous, then you need to make sure that you ask those questions. Okay, so I know that's a lot of information. What I will do is, before we send these slides out, I will add the link to this document that I'm using from the NIH with all of the different screenings on it, and it has it broken up by age group. Okay, I think there's like one more slide maybe, because what time is it? Oh, look at that, we made it. So if you have questions, you can drop them in the chat, or Dr. Sam, you want to come back? Woo! Welcome.
Hey.
We made it.
So that was so informative
Woo!
and great suggestions. I absolutely love it. So there were several questions coming up throughout your presentation, and HR can definitely help with some of those. So one, someone said, I've had shingles twice. Do I still need to take the shot?
I would check that out with your provider. I'm not 100% certain.
All right. So what's the average age to get a mammogram?
Now, mammograms, depending on your history, I want to make sure I don't tell you a tale. Um, I believe that 40 is the new age for mammograms. But give me 2 seconds because I want to make sure I tell you right. Go to the next question, Sam, and I will I gotta find it on my notes right here.
Okay. Next question is, what is your opinion about going to a heart specialist or your regular doctor to check your heart? Should which one? I'm assuming she's saying which one should you go to?
I think that, in my opinion, if you don't have a history of heart disease, and you haven't had like a heavy family history of heart disease, I think it's okay to let your provider check your heart. I think the heart specialist comes into play when you have started to have those signs and symptoms, or you have had a cardiac event of some sort. Then I would recommend a cardiologist. But just for a regular checkup, I think your provider will be able to do that. They check your heart. They listen to your they look at your blood pressure. They listen to your heart rhythms. They have labs that they can check and then refer you out if necessary.
The next question: if blood pressure issues run in your family, should you go more often?
I think that if high blood pressure or hypertension runs in your family and you don't have other risk factors, I think your routine screening is sufficient. If you have risk factors like obesity, you're having high blood pressure, you have other health illnesses, then your provider may suggest that you go more often. But if you haven't been diagnosed with hypertension, I think just the routine visits, as long as you're not having any of those other symptoms or risk factors.
Gotcha. And someone said 40 to 44, 40 for the mammogram. So
That's what I thought.
yeah. So 40 for the mammogram. But is it true if you have a family history of breast cancer, you should be going earlier than that? Or
Yes, some
what
yes, they sometimes some of your plans will cover mammograms earlier depending on your family history.
gotcha.
Yeah.
Um,
And
go ahead, sis.
oh no, I was reading a question, but I'll let you do it.
Okay. Can exercise help with heart health? If
Yeah.
so, what kind of exercise?
Yes, it really is just being active. They were the recommendations are, you start slow, taking a 30-minute walk a day, because it really is the consistent diet and exercise, those things that assist with helping your heart health. So
Gotcha.
in really any exercise. When I think about myself, it's like, whoo, I really need to exercise. And I'm like, well, I don't know what to do. Well, I ain't done nothing today or yesterday or the day before. So if I start with that 10 or 15-minute walk, it really is about that the gradual exercise and making sure that we stay consistent.
Just start.
Just start.
Just start.
I know it.
Just start, y'all. Just start.
Just
Just do
start.
something towards your goal. 15 minutes. That's part of your self-care. That's
Yes.
part of your self-care routine. Let's see. Do we have any more questions?
Yes, and Lestar did co-sign that immediate family history of breast cancer does warrant an earlier screening.
Yes, this was everybody's singing your praises, Dr. Tim.
Oh,
This
thank
was
you so
very
much.
informative. I
Woo.
know there was a question earlier by one of our sisters, and when we were talking about heart health, and she was asking, what about Latina women? What are the stats on? What are the stats for that?
Um, hold please. I did see that in the chat. So there is I'm looking at an article from um Michigan Medical, and they do say that there's an increased risk of heart disease in Black and Hispanic women. So I would imagine that Hispanic women have similar um, statistics as African American women, because it really is around your family history and access and some of those pieces. So, yep.
Cool.
Oh, and
Thank
it does say Hispanic women are more likely to develop heart disease 10 years earlier than non-Hispanic women. And heart disease is the second leading cause of death among the Hispanic population in the United States after cancer.
Wow. Wow, wow, wow. Second, wow.
Yeah.
Second leading. So there you go, sister, who had asked that question. And I think well, I didn't think, I know she also commented that she's going to make an appointment. So yes, that's very, very, very informative. Sisters, we've got to take care of ourselves holistically. You know, we deserve this time. We deserve to take the time to ensure that we are living healthy, and making sure that we're caring for this temple. The stats, yeah, you're right, Lestar. The stats hit different. I mean, numbers don't lie. So make that appointment today, sis. Don't allow fear to paralyze you or to cause you to think, well, maybe it should. No, no, that's not me.
Make
That's
an appointment.
Make the appointment. Make the appointment. Make it today. Um,
Can I just say one more thing too? I know we use Dr. Google a lot, so it's like, ooh, I know I just read about, this chest pain, but I'm gonna look up on Google and see what that means. But please make sure that you are using credible websites, because there is a lot of information on the internet that is outdated. It's old. It's not from a credible site. And so I'm not saying don't use Google, but I'm also saying don't use Google and not go see your provider because Google said that it could be nothing, because there's a lot of information at our fingertips on these websites. And if we aren't diligent in making sure that, when was the last time the website was updated, that date should be at the bottom. Where did this information come from? If you pull up a website with information and every other click is an ad for you to purchase a product or an ad for you to purchase this pill, that pill, you might want to find another website. So yes, use Google and gain some information, but also make sure that you are using a credible resource, and then still using some common sense, because if you don't feel good, and it doesn't go away soon, then we need to check with the provider. It may be nothing. It may be that you need more sleep or we need more water or whatever, but please do not overlook these things. Yeah.
that's
That's
right.
all I
Dr.
got.
Google is not your replacement.
It is not.
Come on, and Wikipedia. Ooh,
Wikipedia is worse,
uh,
actually.
miss. Okay.
Yeah.
There she is, Dora. That's who
Oh,
had asked that
Kendra.
question about Latino women and heart disease. And so there we go. I'm glad that information really made you act, sis. So we're excited that you're going to put this into action and call your healthcare provider. And
Yes.
so Star said it, .org, .org,
And
.org,
.gov.
yeah, and .gov. You took the words right out of my mouth. That was going to be my
Mhm.
next one. .gov, CDC.gov, WHO.org. You have all these organizations, National Institute of Health, that
Yep.
you all can definitely look into. And so, if there are no more questions, I don't see any more, but they were coming in. You ladies are rocking it out. Don't
Oh,
act like that, y'all. Don't act like that, Tam. Don't do that.
ooh, oh,
Tam keeps telling this story that she was voluntold to do this session, y'all. Don't believe that
by
if she tells
Sam.
y'all that story, okay? It's it's just no,
Ooh,
that's not how it went. It played out a little different in my mind. So
I know it. It's all good.
Tam, I'm going to ask you
Yes.
to pray us out in a minute. And so, ladies, don't forget 6:30 a.m. tomorrow morning.
6:30.
6:30. Remember, those of you who took the quiz and won, you won a free nudge at 6:30 a.m. in the morning.
6:30. Claim your prize.
Oh gosh. And Kendra, don't you co-sign.
Thank you,
Kendra,
Kendra.
Kendra, don't you co-sign. Don't you co-sign, Kendra. And so Please don't forget that you all can sow into the word on tonight. I know for sure that it's blessed me, so I'm definitely going to be sowing. You can sow your $5 seed, 10, whatever the Lord lays on your heart. Okay, whatever He lays on your heart. Sow a prayer also. Okay. So
Please.
please do that whenever you get a chance. You know the different ways that you can give. Cash App, Giveify. You can mail it in if you still like to do it that way. By all means, you can, and you can sow into it. So coming soon. So stars putting it out there. Coming school. So
Woo-hoo.
coming soon. The School of Health and Wellness. I'm excited. I'm so
Me
excited the
too.
way that we are approaching um, kingdom work and being holistic with it. I'm so excited to see the great things that are going to come for this circle, Sister Circle International, because we are going day
Yes.
21 in Africa, day 21 in Dubai, day
Mm,
21 in Fiji. It's happening, sis. It's going to happen. I'm
let's
excited.
go.
And so please sow into this on this evening. Don't forget, put it on your to-do calendar, put a reminder in your phone that you need to call your healthcare provider, call your dentist, set up those appointments because they are necessary. Sow into the word. And Dr. Tam, and 6:30 a.m. tomorrow morning, we will see y'all day 12, but 13.
13.
Dr. Tam, can you pray
Yes,
us
I can. Lord, thank you for this beautiful day. We thank you for the opportunity to share information to help us to take good care of ourselves, God. We ask that you would continue to keep us and give us the feeling of authority to manage our health, to be advocates for ourselves, God, to be consistent in making healthy lifestyle changes. Lord, we ask that you would continue to watch over us, and we thank you for keeping us from all of the things that could go wrong in our bodies because of our lack of attentiveness and our lack of consistency. God, we ask that you continue to bless, and we thank you and we love you. And thank you for using me and pressing me outside of my comfort zone to help someone else. In your son Jesus' name we pray. Amen. And good night. Good night.